Hi friends, good evening. Once again, welcome back to my channel Mukambika Nursing. Friends, here we are discussing questions for ESIC exam preparation. We can see the questions. First question, tumor of the hyaline cartilage is called. Options, option A, osteochondroma, option B, osteosarcoma, option C, chondrosarcoma, option D, fibrosarcoma. Our question, tumor of the cartilage or hyaline cartilage is called chondrosarcoma. Option C is the correct answer. And first option, osteochondroma. Osteochondroma means it is benign tumor of bone. Second option, osteosarcoma means it's a malignant tumor of the bone. So the difference between benign and malignant tumor is benign tumor is non-cancerous tumor, but malignant tumor they are cancerous and they can spread easily to the adjacent structures. And last option, fibrosarcoma. Fibrosarcoma means it's a malignant tumor of fibrous tissue. Move on to the next question. The hormone responsible for the maintenance of pregnancy is options. Option A, estrogen. Option B, progesterone. Option C, HCG. Option D, human placental lactogen. Question, which hormone is responsible for the continuation of pregnancy? And the correct answer is it is progesterone. Move on to the next question. The dusky hue of vestibule and anterior vaginal wall due to local vascular congestion is called as options. Option A, Osiander sign. Option B, Chadwick sign. Option C, Gould sign. Option D, Haga sign. Our question is from Science of Pregnancy. Okay, the dusky hue vestibule and anterior vaginal wall due to local vascular congestion is called as Giacomo sign or Chadwick sign. Okay, Chadwick sign or Giacomo sign. If option Giacomo sign is there means that is the correct answer here. Option B, Chadwick sign is there, so that will come correct. And this Giacomo sign or Chadwick sign can be visible on 8th week of pregnancy. That is also important point when the sign will be visible. Okay, it can visible on 8th week of pregnancy. The first option, Osiander sign. Osiander sign means there is an increased pulsation felt through the lateral fornix of the vagina. Okay, this is also can seen at the 8th week of pregnancy. And option C, Gould sign. Gould sign means it is the softening of the cervix. This can be seen as early as 6th week of pregnancy. In Haga sign, we can see the upper part of the uterus is enlarged by growing fetus and lower part of the body is empty and it becomes extremely soft and cervix is completely fine. And this we can see in Haga sign and it can be seen between 6th to 10th week of pregnancy. Move on to the next question. The ability of the body to fight itself against scientific invading agents such as bacteria, virus, toxins and foreign bodies are known as options. Option A, defense mechanism. Option B, immunity. Option C, glands. Option D, hormones. Question is the body ability to fight against pathogenic organisms such as bacteria, virus and toxins or other foreign bodies are known as immunity. Okay, answer option B is the correct answer. Question, next question. The type of consent in case of medical emergency where the doctors start emergency treatment to patient who cannot give informed consent and for whom no immediate family can be reached to make such decision. Options, option A, implied consent, option B, absent, option C, process, option D, written informed. Here the question is, in an emergency situation, the doctor started treatment for the patient without taking patient consent or the relatives is not there with patient. For example, a patient or unconscious patient brought to emergency department as a result of any injury or any road traffic accident. Okay, despite of taking consent from the patient, immediately doctor started treatment to the patient. Okay, this type of consent in medical emergency is termed as implied consent. IMPLIED. Option A is the correct answer. And the next question, period when chronic illness is controlled and signs and symptoms are reduced or not obvious are called. Options: option A exacerbation, option B remission, option C repression, option D suppression. And the correct answer is, it is remission. Option B is the correct answer. Remission means chronic illness or any serious problem, serious illness is controlled and particular serious diseases, signs and symptoms are reduced and not dangerous to patient. That is known as remission. And the next question, which drug should be kept in ward when giving MgSO4 to client? Magnesium sulfate. Options: option A protamine sulfate, option B calcium gluconate, option C naloxone, option D sodium bicarbonate. Our question is, while giving MgSO4 magnesium sulfate to the patient, which drug we should kept in ward? Or the antidote of MgSO4 is calcium gluconate. Option B is the correct answer. And the first option, protamine sulfate, is the antidote of heparin. Okay, and option C naloxone, it is the antidote for morphine. Move on to the next question. According to Triage system of emergency, yellow color code using for which type of cases? Options: option A emergent cases, option B urgent cases, option C non-urgent cases, option D expect to die patient. This question is from Triage system. So in Triage system, a red color indicate first priority or emergency cases or emergent, and yellow color which indicate second priority or urgent care or urgent cases, and green color which indicate non-urgent cases, that is mild injury and all, and black color which indicate expected to die or unable to survive. Here our question is yellow color which indicate urgent cases or the patient which need urgent care. Okay, option B is the correct answer. Move on to the next question. The color of gram-positive bacteria is? Options: option A red color, option B green color, option C violet color, option D light yellow color. And the correct answer, color of gram-positive bacteria is, in staining it is violet color. And the color of gram-negative bacteria in staining is red color. Move on to the next question. The process of synthesis of glucose from a non-carbohydrate source is called? Options: option A lipogenesis, option B glycogenesis, option C gluconeogenesis, option D glycogenolysis. Here question, glucose is synthesized from non-carbohydrate source. Okay, that process is known as gluconeogenesis. For example, glucose is synthesized from lactate or amino acid or glycerol, that is other than carbohydrate source, or non-carbohydrate source is known as gluconeogenesis. And the next question, cardiac output is increased in case of? Options: option A shock, option B arrhythmia, option C congestive heart failure, option D hypoxia. Among this option, in which case cardiac output is increased? And the correct answer is in case of hypoxia. Other options, shock, arrhythmia, congestive heart failure, all in cardiac output will become decreased, but in case of hypoxia cardiac output is increased. So here we discussed previous year questions, also important questions for exam preparation, and the next set of questions we can see in the next video.